Hello, my friends, and welcome back to the Eight Figure Dentist podcast. So, today we're continuing our mini series of podcast episodes, all dedicated to helping you increase your case acceptance / your conversions. So, what I want to talk to you about today is a very common objection that a lot of you are hearing, which is I need to talk to my husband. Less frequently, I need to talk to my wife, but I need to talk to my spouse. And if you have been following along this journey and you understand how I teach case acceptance, you know that this is one of the superficial objections. And there are a lot of superficial objections. As a reminder, what they are is something that the patient will tell you so that they wouldn't offend you, right? They want to be polite, but something didn't click, something didn't work for them. There was a red flag that you or your salesperson didn't notice. And so the patient just wants to politely exit the room. And so they will give you some flavor of a superficial objection. One of the very, very common and so easily used, and I have used that myself too sometimes, is, oh yeah, sounds great. Let me talk to my husband. I'll get back to you, right? And so underneath that, if you're familiar with my work, or if you're not, go back and listen to some of the previous episodes. It's only one of the three deeper objections, one of the three things that didn't fire in that consult room for why the patient gave you this objection. And in this case, it was her belief in herself. Let's say it's a woman and she says, I need to talk to my husband. It was her belief in herself. That's the deep objection that she had, for whatever reason. And so she's hiding behind shared responsibility. Because in many cultures, it is normal to make decisions with your partner, right? It's been so normalized. That's why it's such a convenient excuse to use. But really, what's the reason why she didn't believe in herself? Sometimes it was something different, but let's say that was really the case. And more importantly, how do you overcome it, right? Because you're not a therapist. You can't go deep, or a coach like me, on a call and start asking, some deep questions, or even like confront people. Like, please do not confront patients and say, oh, what really is going on? Tell me what's happening. That's not your real objection. Like, let's just not do that, right? That's very confronting. That's not, your patients will not appreciate it. And I know 99.9% of you will not feel comfortable going there anyway. But how do you actually overcome this objection if in the reality, this is not the case? And I'm going to put an asterisk here, because there are some clinical cases where you, the doctor, believe that the patient should go and think about it. Be honest. If there are cases that you are treating where, if we were on a coaching call and I asked you, do you think he or she needs to go home and think about it? And you're like, absolutely. That, my friend, is the reason why patients are not throwing their credit cards at you. I'm not saying it's a bad reason. I just want you to be aware of this. So if your goal is to have same day starts, or like same day production, but you fundamentally believe that for certain procedures, they do need to go home and take time to think about it, then you're shooting yourself in the foot. Don't make that your goal. Change your goal. Your goal could be total number of starts, or the total production per month or per quarter, because you genuinely believe that patients need to think. I'll give you a specific example. I have two clients with these specific examples in two different niches. One is an orthodontist that does multiple orthodontists that are in this niche that treat surgical patients requiring surgery, TADs, MARPs, stuff like that. And the orthodontist herself believes that the patient needs to go home and think about it because of the pain level, because of the involvement, stuff like that. Notice how I said believes. Not every doctor thinks that a MARPI or a TAD patient needs to go home and think about it. It's not good or bad. It's just different. So recognize what you believe about these cases. And if that's you, then don't set the goal for 90% same day starts. If these are the kind of patients that you want to treat and you're marketing to them and you think that you need to think about it. Are you with me? Change your goal, because you will never hit 90 to 100% conversions, because you don't even think they should start. Do you see what I'm saying? Here, I'll give you another example. I have several general dentists, the so-called super dentists, right? When you guys do these full mouth reconstructions, all of the time you have extra training and you do everything. You do full mouth extractions, you do placements of implants, you restore it, like you're a super dentist, right? These cases are $50,000, $60,000 cases. And you usually offer financing options and things like that for the patients. But some of you think that the patient needs to go home and think about it. So obviously your goal is not going to be same day conversion. Okay. So I just want you to recognize that for starters, right? So if your patients are telling you, I need to go talk to my husband, I need to go talk to the mom, my wife, the dad, and you believe they should, you have created that objection. And that's a beautiful thing. If you want to maintain that, just be aware of this. Okay. Because you can change that. That's number one. Number two, if you genuinely believe, no, they should be committed right now. Like, I don't see any reason why we need to talk to the husband. We should be ready to rock and roll. Then here's how you overcome this objection. I want you to overcome this objection preemptively, meaning before you enter a consult room, you know who's your patient, right? You know it's one person. It's a woman or a man. Typically, it's a woman. Look at their medical history. See if they put a spouse or a partner, if there's somebody other that may be partaking in the decision making or could be a responsible financial party. Okay. By the way, again, another asterisk, if you have a 20-year-old, a 25-year-old, their parents might be very likely financially responsible. So you treat that case the same you would if it's one adult patient there and they indicated that they have a significant other. Okay. So here's what you do. You come in the room and then you say, hey, hello, Mrs. Smith. So excited to have you here. I'm Dr. K. We're going to take a look at your teeth. But before we start, I noticed that your husband is not here today with us. I know making these decisions are typically a joint thing. Would he be joining us? Is it a good time to FaceTime him? Go ahead and give him a text. So your job is to get the husband on FaceTime during the consult. Okay? A lot of the time, I would say 8 times out of 10, the patient will say, oh, really? I can just FaceTime them? I can call them? You're like, yeah, not a problem. Especially if you're treating a child. If you're an orthodontist or you're a pediatric dentist. Get that second parent on the call before you start your spiel, before you look in the mouth, before you do clinical exam, before you do anything else whatsoever. Okay? You're going to say, what I just gave you an example, something in that flavor. Hey, let's get your husband on the call. About 2 times out of 10, they might say, oh, you know what? He's in a meeting. You're like, totally get it. Why don't you text him and ask, because you're going to be here for the next 30, 40 minutes. I'm not saying, Dr. D, you're staying on the consult. Your consult could be 10 minutes, but then your TC or your front desk or your office manager will take over with a financial plan. So the patient will be there for half an hour, right? Just say, hey, just text your husband, totally get it. Text your husband, when is he available in the next half hour? And I will pop in so that I can chat with him. I just want to make sure that you, Mrs. Smith, don't have to do all the heavy lifting, trying to explain all the technical terms that I had just explained to you. I know it's tricky. I went to school for 10 years for this, and I just want to make it easier for you. I don't want to put this burden on you. 99.9% of the time, she's going to text him and then she's going to call him in. Very, very rarely there's a situation where oh, the mom is driving for 3 hours. That happens very seldom. And like, there's no way they're going to be available. They're at the funeral the whole day. They're driving, something like they're having a surgery, something like that. If you have that rare situation, that's when I highly recommend that you get comfortable inviting a patient to record a consultation. The part especially where you're talking to them. Okay? Either on video or audio or both. And here's why. I know it may feel uncomfortable for you as a doctor, but think about it. Who has higher chances converting a husband? A wife that is doing the second-hand language of everything you just discussed, or you? You get my point. You have such a higher chance of doing that I would recommend that you do that. Okay? So that is how you want to overcome that objection. Do not wait until you're done with your consult, you did your spiel, and then you walked out, and then you did your whole thing, and then the patient leaves, and you're like, why did they leave? And your TC or your front desk says, oh, she just wants to talk to her husband. You're like, had I known. Okay, my friend? I want you to intercept it before this becomes a thing. If it's a 20-year-old, 25-year-old, if they're using dental insurance, their benefits will expire when they're 26 in most states. Ask them that question. Hey, are you going to be, literally before we even look at the teeth? Hey, I just noticed that, you're 25, you're 20, you're 26, you have dental. Are you on your parents' dental insurance by any chance? Okay, fantastic. Will they be responsible for treatment, or do you have a great job? Like, how does that going to work? Oh, them? Okay, why don't we get them on the phone? Why don't you text your mom? Why don't you text your dad? Why don't we FaceTime them right now on the phone? So that's what you want to do. You want to get these people. And I know at the beginning it will be a little bit uncomfortable. That was a little bit uncomfortable for me too, but then I got used to it. And when you start closing these cases, you're going to feel so amazing. You will not be afraid to get a spouse on the FaceTime. Okay? So that's what I want you to do, and it works 90% of the time. Now, again, like I said, in the very rare occasion, they are driving across the country, her phone died, she can't record it, like something just absolutely out of the blue situation. Here's what you're going to do. Before the patient leaves, first of all, what I teach inside of the Conversion Queen and in my private coaching is that you need to figure out objections. But if you see a single, like your patient is one person and they indicated that they have a spouse or a significant other, then pop your head before they leave to see if they have any questions and if there's any decision to be made. And if you hear from them, like sometimes I even hear that literally in the waiting room when the patient is leaving, I'm like, oh, we're not taking impression on Johnny today? And mom would say, oh, I need to talk to the dad. I need to talk to my husband. That's when there's two more things you can do. It's like post-emptively. Preemptively, get them on the FaceTime. Post-consult, there's two things you can do. Thing number one is you can say, okay, totally. I completely understand that. I make more decisions with my husband. Like I talk to him as well. So I totally get that. And what do you think he's going to say? Pause. Let her talk. It is a superficial objection. She's making stuff up. She will switch, and give you another objection because that's not a real one. It's like almost never a real one. Very, very seldom there are situations where it's a moral and ethical value for the family to make all decisions jointly, especially when it comes to finances or maybe over a certain amount, like maybe over $500, we make a decision together. Under $500, you make it on your own. Very few families are like that. Okay? So 9 times out of 10, it's a superficial objection. So ask her, oh yeah, totally, I get it. What do you think he's going to say? Listen. Then what you can say is something like, amazing. So what do you think you're going to tell him to make sure that he's on board? Right? Because I want to make sure that you get this treatment. If it's for her or it's for the son or for the daughter, like I want to make sure Johnny gets that treatment. what do you think you might say? Like, help me get the dad on board. Help me get the husband on board because I know how much you want this. So I want to help you. Okay, so that's what you want to say. And the very last thing, that second thing, what you can do is say, totally get it. And let's say you helped her with what she's going to say and she told you the objections and she's still kind of like vacillating. She's still not quite signing the paperwork or not quite giving you the down payment. Then what you can say is, all right, is there a good time I can call and chat with your husband? Like, I'm more than happy to talk to him. Do you guys want to schedule a follow-up appointment? Amazing to get them both on the books. Most of the time people will not do that and they'll just give you the down payment and start. Or just say, okay, what's a good time for all three of us to chat? You will start a case. All right, my friends. And that's how you overcome, I need to talk to my husband, objection. It is so common. It is so superficial. Like I said, 9.9 times out of 10, it is just an excuse. And if you don't know how to overcome this excuse, you are preventing these patients from having the treatment that they want because they're in your chair because they want treatment. Nobody ends up at a dentist chair on a Tuesday afternoon because they have nothing else going on in their life. They made the commitment, they put an effort, they are there because they want to say yes to you and to your treatment plan. Do not stand in the way of that. All right, my friends, I hope this was helpful. And I'll see you in all the places. Bye.